Here we are again, Stuart Schlossman from MSV&N and Stu's Views and MS News. This week's podcast will be about physical therapy. I was asked to do this by a few people, and so I'm going to provide some information. So even after the video closes, you're going to hear narration from me, and then we'll come back to do a little bit more video. Okay? But for now, just enjoy what's left of this program, and we'll be back with you shortly. All right, by narration and then video. Thank you. Hi, yes, we're back to discuss physical therapy and multiple sclerosis rehabilitation. Okay, so with regards to this physical therapy and multiple sclerosis rehabilitation, I just want to let you know that I received this information from the National MS Society. They have it on one of their clinical bulletins. So as for an introduction, I want to read this to you. Rehabilitation is an important part of healthcare delivery for persons with multiple sclerosis. Since the majority of people are diagnosed between the ages of 20 and 50, the challenges of MS affect those at the peak of their career and childbearing years. Although MS can affect children and teens, meaning teenagers, is much less common than this age group. Okay, so it's more common, obviously, in the 20 to 50 age grouping. So, rehabilitation team members need information, experience, and sensitivity relating to the variability of symptoms between individuals and to the unpredictable and fluctuating nature of this challenging, generally progressive disease. Unlike most of other neurological disorders, including spinal cord injury, traumatic brain injury, and stroke, there is no fixed deficit in MS. Symptom profile, lesion burden on it, MRI, and disease course vary over time. Therapists must be prepared to treat each MS patient individually and with flexibility over long term. In the treatment of people with MS, there are no protocols or time limits, just a unique opportunity to employ numerous problem-solving skills, interventions, and resources. And because MS affects not just an individual but a whole family, it is a disease that benefits from a team approach, making coordination and communication with other healthcare providers extremely important. MS poses a variety of clinical challenges that can impact therapy interventions. For example, the very common symptoms of weakness and fatigue caused by impaired nerve conduction in the central nervous system can be exacerbated by a variety of factors: an elevated core body temperature from overheating, overexertion, or infection with a fever, or certain medications such as those to treat spasticity and pain, and another factor is obesity. Continuing, disrupted sleep caused by bladder urgency, periodic limb movements, spasticity and pain, among other factors. Stress is another big cause. Affective disorders such as depression and other medical conditions such as anemia. Many other invisible symptoms are cause for frustration in patients, including impairments of sensation, vision, cognition, bowel and bladder, and sexual function, all of which need to be acknowledged and addressed by the rehabilitation specialist. The ongoing role of physical therapy in MS. The role of physical therapy will vary across the disease course. In general, however, interventions should focus on helping the patient to achieve and maintain optimal functional independence, safety, and quality of life, with the understanding that needs will vary and likely grow over time. In all care delivery models, inpatient, acute transitional rehabilitation or long-term care, outpatient or home care, physical therapists, PTs, must be prepared to educate patients and their care partners about the critical role of rehabilitation, provide training and specific strategies, and provide resources for equipment and accessible, appropriate community programs. They must also be ready to assist with case management and provide emotional support. At the time of diagnosis, patients newly diagnosed with MS benefit from education support and a baseline evaluation by an experienced PT. At this time, misunderstandings about the disease and its management, the importance of appropriate exercise, activity, fatigue issues, and any subtle gait or balance impairments can be addressed. Follow-up should be on an as-needed basis. Following an acute exacerbation, Physical therapy, also known as, physical therapy following an acute exacerbation, also called a relapse or attack, should have the goal of carefully helping the person return to baseline functioning. It is customary to wait 2 weeks after the attack before starting or resuming outpatient PT because of weakness, lack of sleep from IV steroids, or other factors. Patients with primary progressive MS who do not have remissions, their functioning declines gradually but steadily over time. Patients who transition from relapse remitting MS to secondary progressive MS are not able to return to baseline due to progression of the disease that occurs between exacerbations and demonstrate a slow decline in function. Because both groups have a huge emotional burden in addition to their physical challenges, physicians are encouraged to refer a person proactively to PT rather than waiting until he or she is struggling. Focus should be on support, resourcing, avoiding, deconditioning, maintaining safety, and maximizing health and independent function. Assessment of the need for mobility aids now and in the future is essential for these patients and is especially beneficial for the PT to assist the physician in assuring that the appropriate detailed prescription or letter of medical necessity is provided. Patients in advanced stages of MS have significant disease burden, are non-ambulatory, and at risk for other secondary health conditions. Physical therapy for this population will likely be focused on seated trunk positioning and control, transfers, upper extremity strength, respiratory function, and equipment needs. The use of standing devices or standing wheelchairs can be very helpful, providing weight bearing on the long bones, stretching to ease spasticity, relief for bowel and bladder, and improve respiration and speech projection. At the initial session, taking a thorough history is critical. The history should include date of diagnosis, date of nature of initial symptoms, other health conditions, medications, prior level of activity, and top 3 problems in order that they interfere with quality of life. This prioritization will guide the goal setting. The PT evaluation can include a broad overview, so it's important to prioritize time spent with the patient's primary issues addressed first. For instance, posture, trunk control, balance transfers, ambulation and mobility, range of motion, called also ROM or ROM, motor function, neurological function, respiratory function, wheeled mobility, and other important considerations. Persons with MS may have many other issues that need to be considered as part of the PT evaluation, goal setting, and when making referrals to other team members. In addition to vision, cognition, and speech or swallowing problems, it's important to consider each patient's support social network, emotional stability, depression is common, and vocational homemaking history. Setting up goals is very important. It's essential that the short-term therapy goals be patient-driven or their wish list, functionally focused, realistic, and attainable. Home physical therapy programs are important and need to be set up by the PT as well. Exercise in MS. Historically, exercise was something to be avoided by persons with MS, but now it's known as very promotional because anything is better than nothing at all, even if it requires just simple hand movement or gentle yoga, gentle Tai Chi, or water-based Tai Chi, hypnotherapy, exercise. Anything aquatic would actually be good for you. Follow-up. Optimal follow-up for outpatient therapy will vary according to individual needs and typically varies from the traditional. Another major factor is insurance constraints, since the patient may have limits on number of visits per year, per condition, or per lifetime. So, in summary, physical therapists are extremely important members of the healthcare team for persons with MS. As this challenging disease can be frustrating for the patient, therapist, and family, there are no special treatments to learn, but to be a successful MS therapist, one must be willing to learn about this unique chronic disease, listen with sensitivity, evaluate with patience and care, be flexible and prepared to think out of the box, be a cheerleader, be there for long-term, Develop and maintain current file on resources. So, a final quote worth sharing. With the event of disease-modifying agents to prolong time between attacks and slow disease progression, OT and PT interventions are more important and more cost-effective than ever before, I should say. Interventions have potential to last longer and have greater impact on improving quality of life. The bottom line, people, is this. It is up to you to obtain physical therapy or occupational therapy, because they are not going to come to you. You must go to them. Speak with your doctor, find out who you're best able to work with, and contact that person or persons to get started on some form of therapy. So I hope that you all learned something from this narration, and if you have any questions for me, just write to Stuart@MSViewsandnews.org. And right now we're going to go back to a video, and I'll speak to you further from there. Okay? Thank you. In quick summary about this physical therapy podcast, I wanted to let you know that both the National MS Society and the MS Foundation have a lot to say about the topic. And so if you don't find much of it on our site, which it is there, it's on our website. If you go to MSViewsandnews.org, you can type in physical therapy in the search box, click enter, and then articles will open up for you. The same from our blog, which you can access from our website. When you're on the website's homepage, on the left side of the page is our main menu, and in the main menu is a link to Stu's blog, and there's also a link to our blog of archives, or our archived blogs, newsletters, and so on and so forth, as well as other things. So use the menu links and learn to get around on that site. There's just so much to offer. But getting back to physical therapy, yes, the National MS Society and the MS Foundation both have things to for you to read or see on their sites about physical therapy. And again, we want to thank you for listening to this podcast today. And just so you know, a podcast is similar to a webcast. There's different meanings of both, but we use the term podcast. You can always look up previous podcasts or webcasts, however you want to call it, on our YouTube link, which is simply go to www.youtube.com/MSViewsandnews. It's that simple. And yes, you can find us on Facebook. We have a Facebook page for MS Views and News, plus Stuart Schlossman's page has over 3,000 people on it. And now we also have a chat room on Facebook. So to get to that chat room, you'll have to write to me or get onto Facebook, and you'll find a way to become friends of our chat room. There are people beginning to join it. We just started this on Sunday, October 17th, so we'll hopefully be building up this listing very quickly. Sorry about that. It's hard for me to speak when I speak for too long, you know. So again, enjoy our sponsor links, enjoy our sites, and we look forward to seeing you again next week. Take care and have a good night.